Hello, everyone. Thank you for joining us for our webinar on California's Batterer intervention programs. Commissioners and panelists, I am now turning on the ability to start your video and audio.
Well, this was a quite impressive lineup. Good afternoon, everybody. So, Ethan, do you want us, shall we begin the meeting?
I think we should, Mr. Chairman. I apologize if I was late there. I accidentally had myself muted and I didn't realize it. So I think we can begin whenever you'd like.
Very good. I appreciate that. Thank you, Ethan. Well, good afternoon, everyone, and please welcome to the webinar on California's Batterer Intervention Program. This is July 22nd, 2021. My name is Pedro Nava, and I am the chair of the Little Hoover Commission. I want to thank you all for joining us today for our webinar. I want to introduce the other commissioners who are here with us on Zoom. I see Vice Chair Sean Varner. I believe that we will be joined by Commissioner Dion Aroner. Commissioner Cynthia Buisa is with us, Bill Emerson, Cathy Schwamberger, and Janna Sidley. Good to see you all again. I also see that of our legislative representatives, and there's Commissioner Aroner. Hello. Assembly Member Bill Quirk is here with that beautiful waterfall right behind him. And it has been suggested that Senator Jim Nielsen may join us shortly. We also have probably the most important part of today's presentation, absent our guests, our staff. Executive Director Ethan Rarick, Deputy Executive Director Tamar Foster, Project Managers Crystal Beckham and Tristan Stein, and Analyst Ashley Hurley and Rachel Mattioli. Crystal Beckham served as the project manager for our intimate partner violence study, and she will be the moderator for today's webinar. This is a new kind of meeting for our commission. In fact, this is our first webinar designed to highlight our work for legislative staff, stakeholders, and others. Typically, our meetings are a chance for our commission members and staff to gather information from witnesses and others. Today, on the other hand, we look forward to presenting recommendations our commission has already developed and approved as part of our series of reports on intimate partner violence. We're also honored to be joined by representatives from two groups working on alternatives to the current iteration of Batterer intervention programs. We will hear from Marc Philpart with the Alliance for Boys and Men of Color, who will detail the harmful impacts of the state's current statutes on California communities, particularly communities of color. He'll present a model that moves away from punitive rehabilitation centered in the criminal justice system to a community-based approach focused on prevention, accountability, and healing. We'll also hear from Darby Kernan and Ryan Souza from the California State Association of Counties, who will discuss the pitfalls of a one-size-fits-all approach to rehabilitation. They'll present the early results from a 6-county pilot program tailored to batterer intervention programs to the needs of the individual and what lessons policymakers can draw from this data. I want to thank our guests for sharing their time and their expertise with us. Let's do a little housekeeping before we turn to the subject at hand. For our speakers today, your audio and video will be turned on throughout the duration of the webinar. However, we ask that you keep yourself muted if you're not presenting. Thank you to those who are following along and have joined us online. Just like our hearings, members of the public will be muted for the duration of the webinar. After the presentations, we will hold a question and answer period, providing an opportunity for members of the public to ask a question of our panel on today's topic. We've opened up the Zoom chat feature to allow you to send in your questions. Staff will be monitoring the chat box and will review your questions and ask them to the appropriate person. You may also email your questions to littlehoover@lhc.ca.gov. As a standard for the commission, we will also have public comment at the end of the webinar. Those who wish to make a comment will be unmuted during the public comment session. If you'd like to make a public comment, please use the raise hand feature in Zoom by clicking on the hand icon to join the public comment line. If you send staff a comment during the Q&A period, we will ask you to save it for the public comment portion. Those who have joined us by phone may send an email to littlehoover@lhc.ca.gov indicating you want to address the commission. Please provide your phone number from which you joined the meeting so we know who to unmute. Staff will be monitoring raised hands and emails, as is their custom. As is usual at commission hearings, public comment is limited to 3 minutes per speaker. We are recording today's webinar, and after the webinar, staff will place a permanent link to the recording on our website and upload it to our YouTube channel and Facebook page. And now for the substance of our hearing. In our report, Beyond the Crisis, Long-Term Approach to Reduce, Prevent, and Recover from Intimate Partner Violence, we called on the state to re-examine its approach to rehabilitating Californians who harm their partner. Today, we will discuss this call to action. First, Commissioner Janna Sidley, who is the chair of our study subcommittee on intimate partner violence, and Cathy Schwamberger, who also serves on the studies subcommittee, will share some of the commission's research and recommendations on batterer intervention programs. With that, Commissioner Sidley, I'm turning it over to you.
Thank you. Thank you very much. Welcome everybody to today's program. Mr. Chair, again, thank you very much. So in our study, the commission learned that Californians who are convicted of domestic violence must participate in a batterer's intervention program as a condition of probation. There are some things that we learned that we want to share with all of you today. The state law outlines a variety of requirements for offenders and for the content of the programs, but leaves quite a bit of room for variation in the program quality. This can present significant challenges for the participants. For example, a requirement to attend 2 2-hour programs per week for 52 consecutive weeks does not generally take into account the availability of the group sessions, the geography that somebody may have to travel, the distance they have to travel, or the participant's work schedule. And so what we found is that many participants have work schedules that aren't necessarily the traditional 8 to 5 job, and therefore they have trouble finding ways to participate in these programs. And we certainly don't believe that participants should have to choose between the required program for probation and whether or not they keep their job. So that's one point that we did find during the study. Another problem that we encountered for participants in the batterers programs is that programs, as I said before, are not widely available. Service providers that we spoke to in 3 counties, in various areas, particularly one that services 3 different counties in the Sierra Nevada. Because these programs must be entirely funded by the participants, the organizations can only afford to hold 2 session days per week. So that also severely limits the ability for people to participate in the required programs. Additionally, public transportation is often difficult to assess. Many of the clients don't live necessarily close to either bus routes or to the programs, and therefore they also have some trouble trying to participate in some programs. We also saw that the program fees present another problem for participants. Again, we learned that no taxpayer money goes into these batterer intervention programs, and participants pay for the programs themselves based on income sliding scale. And therefore, $100 or $200 for these programs could put a significant impact on low-income families. And so we did see that this is also an obstacle for participants to attend these Batterer programs. Also, what we also saw is that if somebody misses a program and can't pay for a program, they're often then put back into jail because it's a violation of their probation. And then, so when they're put back into jail for 10 to 30 days, well, they often lose their jobs, just making the problem more significant, exacerbating the fact. And also, if when they're released from jail, they cannot immediately go back to their program, then we also learn that often the program resets and they're forced to start the entire 52 weeks over again, thus making that problem of limited resources, again, even more significant. We also learned that the format of the Batterers program is not necessarily inclusive. We learned that it seems to ignore different types of problems within the intimate partner violence communities. And we did not see programs that dealt with same-sex relationships. And so we did find that it was difficult, if not impossible, to find classes also that would deal with people with disabilities. There were no classes in American Sign Language. And finally, we saw a big emphasis on using writing skills as a form of accountability. And unfortunately, we learned through this process, that California does tie with Texas and with Mississippi for the second worst literacy rate in the nation, thus making this program where using writing as a tool for accountability is often a huge obstacle for those who could benefit and need to benefit from these programs. So that's what our study produced many of these findings that we're sharing with all of you today. And so ultimately what we're trying to point out is that a one-size-fits-all approach can fail to address many of the problems that we also saw through our study. Often we didn't see that the one-size-fits-all deals with participants who have had their own trauma or had problems with intimate partner violence growing up as a childhood situation. We found that many of the programs didn't meet the participants' needs. And then, and we also found that there was a lack of incentive for people to seek help before they got into a terrible situation where they would find themselves in jail needing these probation activities. So that is a highlight of many of the findings that we had in our study that we wanted to share with all of you today. And with that, I'd like to now introduce our other fellow commissioner who was a co-chair of the Intimate Partner Violence Study, and that's Cathy Schwamberger. And Cathy will discuss the commission's recommendations as to what the state should do predicated on these findings. So with that, Cathy?
All right, thank you. Thank you, Commissioner Sidley, for laying out some of the constraints that we observed as it relates to these Batterer intervention programs and how that affects participants. Now, I think we want to be clear up front that the commission is not making an argument that Batterer intervention programs are inherently bad. We talked to several program providers who are clearly committed to serving and rehabilitating their clients through the programs that they offer. The problem, as we saw, was that the statute and the system of these intervention programs are structured in such a way that it's nearly down to chance whether the program will work for a participant or leave that participant indebted and sitting in a county lockup, as Janna referred to. So to fix this, the commission concluded that the state should review its Batterer intervention programs to evaluate whether they facilitate rehabilitation. So we really have to stop and ask whether the current system is stopping offenders from reoffending. Now, in an important first step, which will provide some of the data needed to determine whether these programs are working. The state's Joint Legislative Audit Committee approved a state audit of Batterer intervention programs just last month. So this audit will seek to determine if these programs are accessible, if they're affordable, and if they're actually rehabilitating Californians who harm their partners. So up front, we want to thank our next presenter, Marc Philpart, as well as Assembly Member Grayson and his staff for their leadership in making this audit happen. So in addition to asking that question, whether these programs are working, the commission also recommends that the state should begin a process to determine how to create a suite of services that can be tailored to the specific rehabilitative needs of each individual. And needless to say, not all offenders need the same level of intervention. Some people may need a lot of help, such as in finding a home or addressing substance use disorders, even before they're in a mental space where we could expect them to learn from a program. And our second set of presenters, Darby Kernan and Ryan Souza, will discuss their research on this issue in more detail. And then finally, the commission recommends that the state must ensure that all offenders can access these rehabilitative services regardless of their ability to pay. And ironically, if someone treats their partner badly enough that the offender goes to prison, the state pays for the rehabilitation, in theory at least. When there is still a chance to intervene before the abuse rises to that level, however, offenders are on their own. So these are some of the fixes that we thought would be very helpful in addressing intimate partner violence. And so now I'm going to turn it back to Crystal to invite our first presenter to make some comments.
Thanks, Cathy. First, just a brief housekeeping note. We will share the slides with all of the participants after the meeting. I'd like to welcome Marc Philpart, who is the principal coordinator for the Alliance for Boys and Men of Color. It's just one of the many hats he wears. Mr. Philpart has deep expertise in advancing racial, gender, and economic justice, and he oversees a variety of partnerships and projects toward those goals. Welcome, Mr. Philpart.
Thank you, Crystal, and thank you to the commissioners and other staff for raising this critical issue, which has impacted my life and the lives of millions of Californians. We focus on creating sustained safety within the Alliance for Boys and Men of Color. And for us, that concept is really about looking beyond a critical incident or a crisis and even looking before to ensure that the conditions for safety in a community are fully met. And in order to create sustained safety and healing in our communities, we believe we must reimagine our approach to prevention and intervention. And the most egregious example of why a fundamental shift is necessary in our analysis and from our perspective are that BIPs, Batterer intervention programs, are programs that are really failing on a number of fronts. These programs administered by probation fail to meet the diverse needs of people who have caused harm and fail to foster healing. The system really responds in a way that uses state violence to address intimate partner violence, which only continues cycles of violence and harm. There's no focus on prevention, and in that, there's no opportunity to really increase and advance safety for survivors or families and or others in communities. And while there is a lack of a well-designed kind of robust research study on the effectiveness of BIPs, it's widely acknowledged among researchers and leaders in the domestic violence field that there's no conclusive evidence that BIPs actually change mindsets or reduce incidents of violence among participants. A review of BIP studies found that an estimated 40 to 60% of program participants drop out. Furthermore, recidivism rates of violence during or after completion of the program are extremely high, and comparative studies have shown virtually no difference in recidivism rates for those who participated in the BIP and those who have not. These facts underscore this painful truth, and that is BIPs are fundamentally flawed and as a system failed to meet the needs of survivors and those who've caused harm. The violence that permeates our communities and systems requires much more than tinkering with reforms for a failed system. Instead, we really have to think about a much broader set of structural reforms. This is not about individual programs or programmatic efficacy. We know that there are a tremendous number of very committed program leaders managing BIPs throughout the state that are doing incredible work. This is really about an entire system that isn't working to meet the needs of people who are trapped in cycles of violence. As was articulated in the Little Hoover Commission report and by commissioners earlier, California must do more to continue to support and bolster survivor services and do more to invest in and prevent violence from occurring for people who have caused harm and who are trapped in cycles of violence. The Alliance for Boys and Men of Color is a network of over 200 organizations working to transform systems that fail boys and men of color, their families, and communities. We advocate for policy and systems change and support a variety of campaigns that seek to dismantle racist and violent systems and expand opportunity and transformation across a range of different policy areas, including jobs, schools, policing, and the criminal legal system. And violence prevention is a key part of that equation for us. When we began our work, we did so with a focus on violence prevention and looking specifically at community violence, specifically gun violence. For Black and Latino boys and men, gun violence was the #1 and #2 cause of death within the 14 to 25-year age range. And the violence visited upon them was inflicted by youth in their own communities with similar upbringings. And once we began to inquire with our community and our partners how they were addressing violence and what their experiences were with violence, we started to learn some things that I'll share with you here. Some of the leaders commented that their earliest memory at the age of 3 was witnessing their father brutally attacking their mother, and that the violence was produced in their home, was then reproduced in the streets as a young person. Another leader commented that their dad went to prison for domestic violence multiple times, and it only made the violence worse. Through these experiences, we quickly began to understand violence as not only learned behavior that must be unlearned, but that is also deeply and intimately connected to policies that have entrenched structural racism and state violence, specifically the role of the carceral state in communities of color. But tragically, our state's response to partner violence relies almost exclusively on systems rooted in the same type of patriarchal violence that permeates IPV. Ultimately, by relying on these systems, we do nothing to address the root causes of violence or foster healing, accountability for harm, and safety. In fact, by using state violence as our primary response to partner violence, we reinforce patriarchal norms and inherently racist institutions that produce violence, while denying communities the billions of dollars in funding needed to create the safety that will help them to be safe and not experience such tragedy. So that's why our focus has been on reimagining California's response to intimate partner violence and domestic violence, and rooting that vision within public health and racial equity, so that the voices of people who have been harmed and those who have been exposed to this type of violence, those individuals who are usually at the margins, are the ones who are then driving the change that is going to create the safety that they need. Our focus has really been to acknowledge that family violence doesn't occur in a vacuum, and to really take stock of the broader systemic issues around how our country was funded, to think about how white male supremacy, genocide, slavery, imperialism, segregation, all of those things create this dynamic of structural violence, which leads to the interpersonal violence. And so once we began to get into those conversations with community leaders and with stakeholders throughout our network, it was clear that we needed to launch a campaign to be able to advance this perspective in a more proactive way. And so we launched Healing Together, which is a campaign that engages men and people of all genders in the work to build safe and accountable communities. And we focus on healing, gender justice, racial equity instead of punishment as the best strategies for ending intimate partner violence. We're proud that a growing number of organizations have joined us, over 90 and counting. And our focus in this space is to engage men around challenging patriarchy, which harms people of all genders, including men, advance policy and systems change that prioritizes safety and healing for all, that's the root causes. As a community of racial and gender justice advocates, we do a lot of listening. We listen to what survivors and domestic violence advocates need to be safe and to heal. And we hear from people who have caused harm and ask what they need. And together we've developed some collective solutions to build the sustained safety that I've been describing. Just a few of the core tenets of this approach I want to share with you. One, we believe that in order to advance a new vision for batterer intervention programs that prevent intimate partner violence, California must initiate a statewide collaborative process that includes stakeholders in the work of reimagining these intervention systems. Many other states are reevaluating their BIP policies, and it's time for California to acknowledge the depth of transformation that's needed here. Last month, Healing Together partners worked to pass an audit of batterer intervention programs, which Commissioner Schwamberger spoke of. And the audit is a first step to move us in that direction. We're really excited about it. The second piece is that we must shift the responsibility for approval, oversight, standardization, and alignment of intimate partner violence intervention programs from probation agencies to outside of the punishment system. We believe that probation as part of law enforcement is not equipped to be able to provide the appropriate response to healing, to safety that is really needed for people trapped in cycles of violence. This is a public health orientation. This is a social service orientation. And there are other agencies that have more of the fundamental skills required to be able to do that work. Next, we believe we must create a culture of flexibility and customization among intervention programs to address the nuanced realities of intimate partner violence and the needs of the whole family. It was spoke of earlier how rigid sometimes these programs can be. There are huge challenges associated with that, which limit the individual experiences of some of the more marginalized participants to be able to find their footing in the program in real and meaningful ways. And this is part of the structural challenge. Oftentimes, when probation departments are authorizing these providers, they're really looking for model cookie cutter types of approaches instead of looking more expansively at different ways that some of these issues can be addressed and the types of programming necessary in order to address them. In addition, we must expand access to develop additional programs that meet departments, that meet participants' diverse needs. So, you know, we know that many people who are participating in these programs are low income. We know that so many people who are involved in the carceral state or who have come into conflict with the law have a whole host of other issues associated with their situation, whether it's mental health, whether it's low literacy, et cetera. And so really being responsive to complete needs of an individual is critical and important. And in order to ensure that these transformations are improving safety, California must make a commitment to research, evaluation, and continuous improvement of program implementation. We know that very little analysis is accompanying these programs, and the only way to really improve is to better understand what is happening and how these programs are contributing to decreased rates of violence improve community safety and individual and family safety. While these transformations are deep and broad, you know, I'm speaking in big, bold terms here. There's decades of work by anti-violence advocates, survivors, and women of color that this is based upon. And this has really created a strong foundation for us to be able to create new opportunities to end intimate partner violence. We look forward to collaborating with the Little Hoover Commission and all the stakeholders involved as we work to build a more effective and equitable intervention system that prioritizes safety and healing. Thank you.
Thank you, Marc. I'd now like to welcome Darby Kernan and Ryan Souza. Darby Kernan is currently the Deputy Executive Director for Legislative Services at the California State Association of Counties. Prior to joining CSAC, Ms. Kernan worked in the state legislature for more than a decade. Ryan Souza is the Program Director for the CSAC Hub for Criminal Justice Programming. In this role, Mr. Souza works with California counties in using data and evidence to promote better outcomes in county programming. Welcome.
Thank you, Crystal. We appreciate it. Just to give you a quick understanding, the California State Association of Counties represents all 58 counties. And in 2017, with the technical assistance hub that Ryan Souza works on, we were working in 6 counties at the time and trying to work on evidence-based programming and through the criminal justice system. And as we sat down, one of the programs, as you're putting in information about what programs, whether it's a GED class, an art class, the one program that there was no data about was the Batterer intervention programs. And so we started to really dive into this issue and try to figure out what was going on here. Probation departments are required to certify programs within their communities, but they do not have any control over what that programming could look like. So as we started digging around, we created a task force to really try to understand the issue. And I've seen some of the chats where Nadia York, who is an expert in this, who we talked with. And what I realized was California was one of the first states in the nation to create a 52-week program. There was nothing like this 30 years ago. So I think it's really important to understand that there was a landmark decision to move and do this. Sheila Kuehl, John Burden, they got together and they created this program. But unfortunately, in the 30 years that it existed, nothing was changed. As we moved to evidence-based programming, when we learned that people need risk assessments to figure out what their needs are, or to understand if somebody has a substance use problem, that they probably can't jump right into a batterer intervention program if they haven't addressed some of their other issues. And so as I would say, criminal justice programming has developed and changed and grown, the batterer intervention programs have stayed the same. And I, as somebody who represents counties, I want to be honest, probation departments have very little flexibility in what they can do. So I will say in one county, there's one batterer intervention program. Well, with one batterer intervention program, and you don't have any others, but people have to go to a program. Certification is, what are you certifying, right? So I think I agree with Marc on so many issues that we need to change the system, and it's a hard system to change. I think when I kind of moved into this area, I was very surprised in the resistance that we received from advocates as well as providers that this system works. And I find that there is nowhere else in our criminal justice system that offenders are required to pay for their programming. You don't pay for your behavioral health treatment. You don't pay for your substance use treatment. And this is definitely something that should be treated the same. But I will tell you, that was a very controversial issue to raise, because a lot of people still feel that it's about paying dues for the wrongs you've committed against a person. And so I guess as Ryan Souza kind of goes through the data, that the work that CSAC has done, we from our working group, we created AB 372, which is a pilot program in 6 counties, allowing them flexibility in how they provide batterer intervention programs. It doesn't have to be 52 weeks. They have to do a risk and needs assessment, and they have to provide the service and kind of track the data. Marc, a lot of the information you mentioned is about the things we know. They're things we know because we assume. There is no data out there that anybody has that these things are true. Yeah, we assume that the violence is, we know that if a child is raised in a home where there's domestic violence, that there is a likeliness for them to become batterers themselves. Like, we know a lot of these things based on common sense, but the data doesn't exist. And I think one of the things that the Little Hoover Commission is doing is really bringing this up. I'm very proud of AB 372 and the work we're doing because we have data for the first time. And I'm gonna go ahead and kick this off to Ryan so he can walk through some of the information, the details of AB 372, and the data that we're getting. But I would just say this is the beginning of a really long conversation. We started this work in 2017, and I thought at that point we were making a lot of progress because we got a bill introduced, but we are just starting, and it's going to be a really long, hard path to make changes to these programs. So Ryan, I kick it off to you.
Thank you, Darby. If we can go ahead and just put the PowerPoint back up. So today I'm going to talk about kind of a specific piece of this very complex system that everyone has already been discussing. And that's AB 372, really related to the pilot program that was put into place, allowing counties some flexibility. And so if we can move to the next slide for me. As Darby had kind of mentioned, CSAC's role in implementation of AB 372 is really to try and be a conduit for counties, helping guide and relay their efforts to stakeholders, and then provide technical assistance in data reporting, developments, analysis, and ultimately synthesis of the information that we're getting from these pilot counties. And then one of the most important, I think, spaces that we'll talk about in just a minute is really a space for county collaboration, having counties and probation agencies that were energized and ready to come to the table to discuss kind of this stagnant system that has existed for a while. And so you can see before you part of the overall items required for AB 372 was a report to the legislature. And in that report, we wanted to kind of accomplish four things in this first report, which is context around implementation and ultimately impacts from COVID-19. We wanted to explore differences in client populations and underlying demographics. Darby mentioned it, not a lot exists out there. And so really kind of looking at that really helps pave the way for future policy decisions in terms of programming and approaches. And then finally, in these pilot counties, identify evidence-based and promising practices, both at the intervention level and the curriculum level. And then, as I mentioned before, a really big piece of it is really convening policy and practice work groups to discuss the risk, needs, responsivity issues that exist, what kinds of dosage people are ultimately going to be getting during these programs, and then decision-making frameworks, following a pathway to make sure that people are placed into programs based upon those risk and needs assessments. Let's go ahead and go to the next slide, please. So the key aspects of AB 372 are before you. They are, I've mentioned them already, but really performing a risk and needs assessment for future recidivism and intimate partner violence using validated tools. The second item is treatment referrals that are based upon those risk assessment results. Third, treatments are either evidence-based or promising practice in their actual design. We'll talk about that in just a minute. And then that programs have a written curriculum and operational guidelines. How are you going to approach delivering the curriculum and what are the operational guidelines around it? And I apologize, I am Uncle Daycare today. So if you hear a small voice, she is bouncing on my knee. And then finally, treatment dosage. If treatment is less than 52 weeks, is it established by those risk and needs assessment? What does that decision-making framework pathway ultimately look like? Let's go to the next slide for me, please. So the pilot of AB 372 is really about domestic violence program interventions designed to address intimate partner violence. But its approach in 372 is really done through the dosage and flexibility and reaching participants in ways that, through those validated tools, will meet responsivity issues. Some of the assessments include how they view partners, but also the general risk to reoffend. Past studies have shown mixed efficacy, as well as, ultimately not really understanding what impacts exist in the programming that exists. The first three approaches that you see before you on the chart really incorporate cognitive behavioral intervention approaches. And then the final one, Streets to Schools, is a psychoeducational approach for low risk offenders that are really delivered through its online platform, providing additional flexibility. You can see in the table before you, the high risk, medium, and low risk all have different subsets of weeks that participants would attend, and ultimately different interventions that have different levels of intensity for dosage. And so one of the big things that I think could be mistaken is just because it is a shorter number of weeks, or just because it is 52 weeks, the actual dosage delivery might be the same, it might be more, but in ultimately the pilot counties, they're trying to provide flexibility so that people can attend these programs and do so with the idea of trying to complete them, not necessarily in a rigid way as defined outside of AB 372. And so please, let's go to the next slide. So COVID impacts on year one. Everyone has probably been aware of this, but both when you're developing a program that is in that 2019 timeframe and then COVID-19 hits, you have really the ability to not deliver face-to-face programming. There's also reduced supervision engagement. There was provider capacity, and really the ability to transition to online models rapidly caused issues in terms of ultimately rolling this out. And then a big one is cases and trials are delayed. So number of people entering the system ultimately is still an unknown, and it will be kind of fleshing that out as we move through this year. And then finally, shelter in place mandates have really pushed acts of domestic violence into the shadows. The more that we are coming out of this, the more that we are learning, but these are all things that we expect to really need to be focused on and really reviewed as we move through this information so that it's not taken out of context, understanding that this year one is not a typical year one in terms of program delivery. Next slide, please. So the slide you have before you is kind of the outline of data that we're getting with risk assessments using the validated tools. This, again, provides levels of supervision that are tied to risk to reoffend and the risk of future intimate partner violence, and really helps give probation more flexibility in meeting human service needs as well as public safety needs. One of the ideas behind delivering risk assessments is understanding those levels so that you can incorporate other aspects. The numbers you see before you are nearly half of people have a general risk to reoffend in the low category. That means there's probably a lot of other human service needs, preventative needs, or simultaneous needs that exist out there that need to be incorporated into programming and ultimately designed so that people have the flexibility to have those needs met.
Ryan, could I add in just on that? Sorry to interrupt, and I keep bouncing because you have a baby. I can't help my mom skills jumping in. I think this is a really important slide that I would like us to focus on for 1 second, because current batterer intervention programs do not separate low risk and high risk offenders. And so one of the things that we found before we started the AB 372 is that when people come into a batterer intervention program, they come in at different times, and they get to pick the program that's closest and works for them if it's a certified program. But you may have someone who has a misdemeanor domestic violence first act being in a group with somebody who got out of prison and had an attempted murder charge and various domestic violence charges in the past. So that these people are in one room and, a guy can totally disregard anything that's happening because he doesn't see himself in that same person. And so one of the key things we feel that all programs need to have is you have to do a risk and needs assessment so that you're putting the right people in the right group together. It's really, really an important factor. Thanks, Ryan.
Thank you, Darby. And Darby mentioned it, but one of the big things to take away is not all recidivism is the same, and counties have developed different tools. And so having these risk assessments and the use of decision-making frameworks helps also make sure that the correct dosage or an intervention dosage is given to those most in need. It starts to differentiate categories so that you can better effectuate the change that you're ultimately seeking. Let's go to the next slide, please. So what you have before you is some criminal history points that we have. So half of people that are involved in programming in the pilot counties had a prior domestic assault. Nearly half had violated release conditions or restraining orders, and nearly half had spent 30 or more days in custody in the past. And so this data, as Darby had mentioned, is so important. It's at the first look at being able to start really diving into the type and the demographics around the population that are participating in these programs, and start to really think about, can we meet these people before they enter the criminal justice system, or as they enter the criminal justice system? How can we help reduce those impacts and that cycle of violence that will continue afterwards? And then, you know, it's noted in here, but half is too many. You can see that along the way, 50% is continuous. And so really it just goes back to, there needs to be a more nuanced approach, and there needs to be attention to the human service interventions, not just the BIP programs and domestic violence. Let's move to the next slide for me, please. And so what we have, again, is demographics. This was really exciting information for us to see because, again, it helps us have those conversations that may not have happened in counties before, where we start to really understand who is out there. That is what we're seeing in the pilot counties are 57% are under 35, right? We have an age issue that we need to make sure that we're addressing in the curriculum. 38% are unemployed. It goes back to those human service needs and other needs that people have, where you need to have employment. It was already discussed today about the pay model. So when people are unemployed, who's ultimately paying for that? How do those family dynamics work? How does that impact the continuation of intimate partner violence in people that are participating in these programs? And then the final one that or the final two, excuse me, are 89% are male, and approximately 3 out of 5 identify as Hispanic. These are also important because it goes back to the gender responsive and cultural issues that exist in these programs and making sure that they're being addressed. When you have 89% male, you also need to know 11% are something else, female or other. And they also need to have a category in this program to make sure that they are being addressed as well. And so this kind of information to us was really a highlighting point in year one that we really started to pull from to say, now we can have a more nuanced discussion about how programming should be approached. And so this culminates kind of the year one report. There's a lot more detail. And this is really about kind of identifying those initial demographics. There was not enough time in year one, obviously, to ultimately get through in terms of outcomes when you have delays because of the COVID-19 pandemic and just in general curriculum design. You don't have the number of weeks necessary to ultimately track outcomes. And so let's go ahead and move to the next slide.
And then if I can just add, even being on slide 2 is perfect, but just this is the first data that we have about programs that are being provided. And I think that people have to understand that the state's responsibility in this, they have no hands on. And so we really, as we're looking for changes in these programs, we have to think about what the county responsibility is, what the state's responsibility is, and then what we expect providers to do. Because I think having realistic expectations on all three, it's what's important for reforming a system. Thanks, Ryan.
Thank you, Darby. And as we get into the year two report, not only will we have kind of the continuation of demographic information that we're currently gathering, but we'll have the first look at program outcomes, arrests, restraining orders, convictions, completion rates. And then ultimately, we're also trying to incorporate per AB 372 guidelines, victim perspective. That's often left out of conversations and also is an important part of this pilot and ultimately BIP programs in general. And then finally in year two, we're really looking to kind of provide continued updates on operational changes and adaptations. As counties learn more, they want to make more changes. They want to, reformat how things are being delivered. And so continuing to describe those things. And so that is it. We have my contact information after this. Thank you so much for bearing with me. I have a very excited participant here about the changes that we're discussing today. And so thank you for your time today.
I would just add on that we are doing an extension of our pilot. So that's going through the legislature right now. So we've added another year so we can get more data and research. But I will say that even trying to get a 6-county pilot program to do different programming in batterer intervention programs was heavily controversial. So it's a warning, if nothing else, that you know, as we're entering, and I am so excited that the Little Hoover Commission is interested in this and that there are different groups looking at these issues. It is a hard path, because when making changes to systems that haven't been changed in 30 years, they need it, but there are also a lot of good things in these programs that I don't think we want to ignore. And so the existing providers have some experience that we should definitely take away from, but improving it and making sure that we are collecting data, that we're getting evidence, in being able to morph these programs to improve the treatment of anybody who needs the assistance is really important. So thank you for the opportunity to speak today. We really appreciate it.
Thank you so much, Darby and Ryan. So we're going to turn to the question and answer period now. If you are joining us by Zoom, please submit your questions through the chat feature. We, the panelists, will be able to see your questions, but the audience will not. If you are joining by phone, please email your questions to littlehoover@lhc.ca.gov. To respect everyone's time, I will combine similar questions. As typical of commission meetings, we will hold a public comment period following the question and answer period. If you have a comment instead of a question, please share it during the public comment section of the meeting. And we will send around the presenter's contact information. We unfortunately will have to stop the Q&A at 1 to go to our public comment period. So please feel free to follow up with our presenters if we don't have time to get to your question. So I'll start by addressing some early questions that came in during the Little Hoover component of the presentation. We've heard from some service providers who discuss how they structure their Batterer intervention programs to meet the needs of their participants and how they go out of their way to keep their participants from being jailed on probation violations. During our study process, we also had the opportunity to meet with providers who went above and beyond for their participants. And we're not trying to suggest that all programs and all service providers are bad, because we were blown away by the commitment and dedication of some of the folks we met. Our concern is that your ability to access rehabilitative services and your ability to maintain your livelihood while you're doing so shouldn't be dependent on which county you live in or which program is available to you. It shouldn't be down to luck. We should work to ensure that all Californians statewide have access to something that will help them with their rehabilitation while not endangering their livelihood. I'd also like to clarify that when we mentioned that we pay for people to be rehabilitated in prison, but we don't pay for Batterer intervention programs, we were discussing the rehabilitation component of the Department of Corrections and Rehabilitations, and we're not suggesting that there were Batterer intervention programs or certified Batterer intervention programs in prisons. So now to go to more recent questions that came in. Let me see. So this is to the CSAC team, and they ask, does the data look at whether the prior domestic violence is with the same victim, or are they a serial batterer?
I think Ryan can answer it, but I think I'm right when I say we don't know that level of detail. We only know if there has been another charge, not who specifically that charge is against. Although I will say in our year 2 study, we are definitely going and trying to get more victim input and trying to see if we can get some more information in that area.
Okay, and then let's see. We had someone ask about parole versus probation. Oh, here we go. Well, this is to Ryan. While the focus is on Batterer intervention programs is probationers, how does this impact individuals on parole?
Right now, parole is using county level programs. And so to the extent programs are changing at the county, parole would leverage those programs. And it was right earlier, something that is in discussion, but the Department of Corrections is not currently doing anything in terms of relation to domestic violence or intimate partner violence programming inside. There probably are, I wouldn't speak for all the community-based organizations coming in, but it is an important topic that is elevating kind of everywhere. And so the more that counties are changing, they're really driving that change across the state.
And this is to everyone, and they're asking what would be necessary for the state parole or probation statewide to change to 26 weeks.
Statutory changes would be required, but I think that what we have found, at least in the pilot programs that we're in counties, is that there are people who need different levels of service. And so actually saying a certain amount of time isn't really the answer, in our opinion, that you have to do a risk and needs assessment. You have to understand what an individual is going through, and then really treat them until you know that they have received the services they need. By saying 26 weeks, if somebody has been, grown up in a home of violence and has very deep wounds and needs a lot of treatment, that may not work for them. So I think that the worry about, there are different programs all throughout the country, some 26, some 52. I think actually California may be one of the last 52-week programs, but we really don't think that it should be based on time, but necessarily their treatment needs.
Can I add to that and just underscore what Darby has mentioned here, in that, people spend lifetimes involved in violence, and to presume that a 26-week or a 52-week program is going to sufficiently move them into a place where they can adopt a different way of being in the world is just not realistic. And it really gets to the point about scale and the fundamental kind of challenges associated with this program. When you look at the research, 90% of the participants, roughly 90% of the participants are men. And yet there is very little put into preventing violence before it occurs. I'm really excited about the prevention works funding in the budget, and how 15 or so million is continuing to be appropriated for prevention. But if we really hope to prevent and intervene in violence, we have to scale that number significantly in order to address the need. And I think that there is a fundamental difference in doing that work versus what BIPs are. If the state had men's nonviolence programs, for example, that could very well be open to anyone who is not court mandated, but who may have experienced violence or just want some programming in order to not be violent. And so I think there's a tremendous opportunity there. The one point that I think is important to draw a line around and requires further conversation is around risk assessments, because there are many in the racial justice community and many community safety and justice advocates who have vehemently argued against risk assessments because they're considered to rely upon data and inputs from an inherently racist and biased system, and really embed the inequities in the injustice system. And so, it was recently found by Ohio Supreme Court that the Ontario domestic assault risk assessment was a problem. That they cited a study from PPIC that basically said that equity is an ongoing concern with risk assessments, and counties face data challenges in testing a tool's accuracy and equity. So I just want to put that out there and caution us against embedding risk assessments into this program in ways that cause further inequities.
Crystal, I'm going to jump in if I may interrupt. I know that we're running out of time, but I do believe that Commissioner Buiza has a question. And so I wanted to, Mr. Chairman, if I may, recognize Commissioner Buiza.
Thank you so much, Ethan. And thank you to our panelists. This is an amazing conversation. I have a very particular question around abuse rates among immigrant and refugee women, because for this population, it's about 50%, which is about 3 times the national average. Do these programs and services that we've talked about account for the particular vulnerabilities and needs of this population? Because often immigration status is used to silence the victims. And I am curious if there are programs designed specifically to account for this reality.
Commissioner Buiza, I do not know the answer to that question. I don't know if Crystal does, or if any of if Mr. Philpart or Ms. Kernan and Mr. Souza have
I
anything
think,
to add on that.
yeah, I would just say, Commissioner Buiza, you're pointing out a really significant pain point in how these programs are operated. There just aren't enough, there's not enough attention paid to this community. There's only one program that I know of that is even focused on intimate partner violence in the immigrant community. That's Mujeres Unidas y Activas in San Francisco. But regarding the Batterer intervention element, I don't know of many that are doing that work. And so I think this is another kind of blemish, if you will, on the system and the need to be more inclusive.
Thank you. Thank you, Marc.
So we have a bunch of great questions in the queue. Unfortunately, we have reached the end of the Q&A comment period, and we'll move on to public comment. All of the panelists can see your questions, and we will send out everyone's contact information, so you will be able to follow up with them one-on-one. And you can also feel free to make a comment to the commission as we switch to the public comment section. If you would like to make a public comment, please raise your hand in the chat feature, and we will unmute you. If you are joining by phone, please send an email to littlehoover@lhc.ca.gov and include the phone number you're calling in from so we know who to unmute. Thank you.
And Crystal, we can go ahead and ask Ashley, I believe, to recognize, I believe we have at least one person who has raised their hand to make public comment. Ashley,
Yes.
can identify that person.
Yes, Roman James, I am turning on your ability to talk.
Can you hear me?
We can.
Okay, so in regards to, and I had posted this question in the chat, how are you dealing with the more pervasive and pernicious form of coercive control that's not always in the form of physical abuse, whether it's stalking, physical or cyber stalking and monitoring, financial, psychological, emotional abuse, stalking by way of the courts, which is more and more prevalent and is being, just completely ignored by institutions, DCFS, LAPD, and certainly the courts, where there are ways that abusers are utilizing institutions to continue to maintain control over their victims. Because most of the time, it's not even about physical violence. And I'm always hearing Batterer intervention centering on physical violence, but there are cultural issues related to machismo in the Latino community and in the immigrant community in relation to how women are perceived. How is that being addressed? Because I feel like through this conversation on physical battery, we're missing like a whole minefield of ways that abusers can undermine someone's peace.
Thank you, Ms. James. We'll follow up with you more after this session. During public comment, this is really the opportunity for people to make comment to the commission if they wish, and for the commissioners to hear from members of the public. And so I appreciate your comments. Our
Ethan?
commissioners are listening and we'll follow up later.
Yeah.
Yes, Mr. Chairman.
Yeah, Ethan, thank you. This is Pedro Nava. Yeah, Ms. James, the issue that you raised did come up in terms of testimony that was provided during the work that we did. Commissioner Sidley and Schwamberger noted that as well. And I believe that we did touch upon it somewhat. Part of a resolution is going to have to be legislative with respect to how you define violence and how you define a means that where you coerce people without physically harming them. And so I did note that there were something in the neighborhood of 138 people who were participating. A number of them are staff members of legislators. And it may very well be that what you have helped to spark and that we will follow up on is to assess whether or not there is an interest on the part of the legislature to begin this conversation about expanding the definition in order to include the sorts of things that you have pointed out that are used to control people, that are not necessarily physical violence, but it is emotional violence, it is intimidation, it is instilling fear in people, which can oftentimes be a much longer lasting harm. So thank you for raising that issue.
Thank you, Mr. Chairman. Ashley, if we can go to the next public commenter, please.
Next public comment is Beverly Upton. Beverly, I'm turning on your ability to talk.
Thank you, Crystal. So this is Beverly Upton with the San Francisco Domestic Violence Consortium. We really want to thank the Little Hoover Commission and all involved for continuing to look at these issues. I just really want to say that many advocates across the state of California are not opposed to funding for Batterer's Intervention Program attendance, but we do run into trouble when we talk about taking it from survivor-centered services. So I think that is a conversation that could be revisited as we look at universal basic income. I think we should be looking at that for survivors of domestic violence and their families that could perhaps even include someone who has done harm. I think to paint the domestic violence community as being against public funding for intervention is not true. And also there are some promising practices that I think early on, I was part of these early conversations, that promising practices were really not examined. San Francisco is not the only city that monitors its batterers intervention, but there are many promising practices around the state. We did not have to recreate the wheel to do this. An actual research project could have been funded to look at batterers intervention and other ways to intervene and also support the committed, life-saving batterers intervention facilitators, which we don't seem to hear very much from in this conversation. So I want to thank you for this work. I know it continues. Women are continuing to die. Children continue to die. This is a crisis. So I can't thank you enough. Thanks.
Thank you, Beverly, for your public comment. Next, we're moving to CT Weber. CT, I'm turning on your ability to talk. CT, it looks like you're still on mute. If you could unmute yourself.
Okay, is that better?
Yes, we can hear you now.
Thank you. Yeah, I wanted to expand a little bit on the abuses that are taking place in society. Not only is there physical abuse, which can include sexual abuse, but also there's mental abuse. There's even neglect is a form of abuse. And the other thing I wanted to just touch on for future consideration is police violence. There really needs to be some retraining how we handle situations, and the whole military approach and the buying of military hardware and that stuff just sort of amplifies the feeling among a lot of people of an occupied army rather than a police force. That's all. Thank you.
Thank you, CT. Next, we're moving on to the Association of Black Social Workers. I'm turning on your ability to talk.
Yes, my name is James Maddox, and I'm with the Association of Black Social Workers. One of the things that I'm focused on is that Dr. Carla Stover out of Yale wrote a paper called Training and Certification for Domestic Violence Service Providers. And in that paper, she outlines the need for more training for providers, both batterer intervention and also people who are working with survivors. I implore you to take a look at her paper and also contact her. It's going to cause a scream because we are going to force people to increase their knowledge and their skill set in order to participate and work with this population. Thank you.
Thank you. Next, we're moving on to Edgard Profat. Edgard, I'm turning on your ability to talk.
Hello there, can you guys hear me?
We can.
Great. Okay, thank you so much for the opportunity to be here today. It is an honor to me to serve the community. Before I start, I would like to say special thanks to Beverly Upton for the understanding that people is still dying for domestic violence in California. In fact, last week, somebody of a very well-known business in Marin County, California was shot 4 times in the chest in a dispute for domestic violence. One of the things I hear during this meeting is the statement that most clients do not complete the program. I think that is completely untrue. 99% of the clients in my program, they successfully finish the program. And we cannot generalize the effectiveness of all programs because all programs are different. I do hear of some programs where the facilitator is either colluding or is not effective, and yes, they probably drop classes. But it's about the program, the facilitators. We can make a general statement saying that most clients are dropping the program. In my case, that's completely untrue. 99% of my clients will finish the program, and that's my responsibility. In regards to the clients paying for the program, I have provided services on a substance abuse programs, on a free program, and in a paid program. On the free program, most clients, they do not take the program seriously. In domestic violence programs, paying for the program is not about punishment because that's not the idea. And that again is about how the facilitator is going to present that during the intake. But it creates accountability and inspire the clients to value their classes. Statistically, most free programs and online programs are not successful and have a higher rate of clients dropping the program. An assessment to direct clients to a low-risk program providing only 10 to 26 classes will only encourage the client to be in denial and to minimize their violence. Offenders of domestic violence crimes have a controlling personality by nature. All offenders will attempt to be directed to a low number of classes. I myself experience in daily basis having a phone call with the victim asking me if it is a way to have the offender having more than 52 classes because they strongly believe that the abuser is just controlling the system, but he will go back to his old violence part after the 52 weeks are over. The statement showing that 38% of the Hispanic clients, remember that I am Hispanic myself or mestizo. So I say I am the son of an Italian woman, but I lived 10 years in South America. The statement showing that 38% of the Hispanic clients are unemployed is not true. Most Hispanic clients do not apply, especially those ones that are undocumented. They don't apply for service. They are experts finding work under the table. Even those ones that are on Section 8, they still work under the table. I know that most clients will come to my office and say that they are not working at the beginning, okay, in order to avoid paying for the service. But the truth of the matter is that they are working. The number of stating that 38% of the Hispanic clients are not working is completely untrue. It's no way that they can survive. And I have developed my own ways during the intake as a facilitator.
Sir, we do have a 3-minute limit on public comment. If you could please wrap up, you're well over your 3 minutes, I'm afraid.
Thank you. I truly appreciate it. Actually, this was my last statement. Normally, if you ask a client during the intake, will you be able to prove the jobs that you are producing in the United States of America and you are working? They change their mind right away and say, yes, I am working. So 38% is completely unreal.
Thank you, sir. Ashley, if we can go on to the next public commenter, please.
We have no additional requests for public comment on Zoom or on email.
Very good. Then, Mr. Chairman, I believe we have completed the agenda for today, and we will follow up. I do see one comment in the chat. The answer is yes. You may certainly email us, and we are happy to follow up with anyone who attended today's event. And Mr. Chairman, I know we deeply appreciate the participation of so many members of the public.
Thank you, Ethan. Let me express my appreciation, obviously, to the guests who came to share their information with us, but also to the commissioners. You know, you've taken time out of your day and rearranged your schedule in order to participate in what is the Little Hoover Commission's very first webinar. And I think this is a direct result of commissioners having expressed to staff, to Ethan and to staff, how they believe that additional outreach is important, so that many more folks in the community know the kind of work that the Little Hoover Commission does. And once again, I want to express my gratitude and appreciation to staff. I'm looking at how staff is putting together the materials that are attractive. They contain important information. They are easy to read, and they help the public understand how it is that they can participate in these conversations that we are having. And I'm very, very grateful for the level of competence and enthusiasm that our staff demonstrates each and every day. And with that, I am assuming that we can adjourn the webinar.
I think we can, Mr. Chairman. I'll just briefly mention, for the benefit of commissioners who are still in the meeting, our next meeting is 3 weeks from today, August 12th. That will be a meeting at our normal time of 10 a.m., 3 weeks from today, August 12th. And we anticipate, among other agenda items, that we will be submitting the report on the pandemic and childhood well-being to the full commission for commission approval. That has already gone to the subcommittee and is now being reviewed by the subcommittee. We will also anticipate we will be bringing you background research as requested on the PAGA and foster care issues, so the commission can discuss possible future study topics. So 3 weeks from today, August 12th at 10 a.m. Other than that, Mr. Chairman, I believe we are able to adjourn.
Thank you, Commissioners Sidley and Schwamberger, for your leadership on this issue and for helping navigate our work. See you soon. Stay safe.
Thank you.